Hello, this is Sudharshan, and in this episode PA 28.16 we will talk about urothelial tumors or bladder cancers. So in this urothelial tumors, the most common one is transitional cell carcinoma. So this is a cancer that affects the transitional epithelium, that is the lining epithelium of the bladder. And most common cause is P53 mutation. And there are two theories that will suggest field effect and implantation theory. So field effect, that is nothing but if the tumor is there in a particular area of the transitional cell, it can break off and then move along the fluid, that is the urine. And implantation theory, that is where the tumor cells will be attached in different sites. So these are the two important theories. And risk factors, for this there is a mnemonic, that is PSAC. P for phenacetin, S for smoking, A for aniline dyes, and C for cyclophosphamide. This is very important, mostly cyclophosphamide. It causes hemorrhagic cystitis, that is the bladder infection with bloody discharge also, because the surrounding vessels are also affected. So the tumor is invasive, so it can spread to various sites. And when it comes to clinical features, most important, painless hematuria. That means blood is there in the urine, and while the discharge is happening, there is no pain. And there is flank pain, that is a region between the thoracic wall and the pubis. And then also it can be above that or suprapubic, it can be perineal or abdominal, anywhere. It can lead to dysuria, difficulty in urination also. Right. And with respect to the diagnosis, cystoscopy can be done to detect the presence of tumors which is there. And labs also we can do to see we'll do a urine analysis and culture. If any infection is there also, we can identify. And with respect to the treatment, surgery with chemotherapy and radiation therapy. And briefly with respect to gross and microscopy. So grossly, how is the tumor? If we can see, so we can see that the tumor is in one particular area of the transitional cell, and then later it is going to spread. Or sometimes it can be a flat with no folded epithelium, that is what, papillary projections. And most important, microscopically we can see the papillary tumor, the outward folded epithelium with excess growth of the transitional cells. And it is anaplastic, that is undifferentiated cells are also present. Right. So that is all with the urothelial tumors. So thank you so much. We'll see in the next lesson.